Hello everyone, and welcome to the Chapter 12 lecture for Crowley's An Introduction to Human Disease. This chapter is all about disorders or diseases of the circulatory system. So as a reminder, the circulatory system is the system that circulates blood through the body, through the heart, and through the lungs. So there's really two circular pathways. There's the circulation between the heart and the lungs, and that's where deoxygenated blood gets pumped to the lungs to get oxygenated. That's the pulmonary circulation. And then there's the systemic circulation where that oxygenated blood gets pumped from the left ventricle of the heart out to the body. So now in this chapter, we're going to learn more about the various vessels, the arteries and veins and capillaries that are responsible for branching out through the body and delivering that blood and oxygen and nutrients and everything else in the blood. So the types of blood vessels, the three main types of blood vessels are arteries, veins, and capillaries. So arteries are usually drawn in red. Their job is to carry blood away from the heart. So remember the pulmonary circulation, everything's kind of reversed. There's three types of arteries. So they're kind of based on size, but also on their layers, the makeup of the different layers. So elastic arteries are the largest ones, like the aorta and the abdominal aorta, and the greater arteries. These are elastic, meaning the outer lining is very elastic, and that is in order to be able to receive the high pressure from the blood pumping from the heart pumping the blood. And so it needs to be elastic to be able to withstand the great pressure of that flow. And then as we branch down, the aorta and arteries split off the aorta. Many of those arteries are what we call muscular arteries, so they have a very thick layer of, a relatively thick layer of smooth muscle. So arteries are much more muscular than veins. Veins have a very thin layer of muscle. Arteries have a thick layer of muscle, and they can contract or constrict in order to narrow the blood vessels, the arteries, and increase blood pressure, and they can relax and dilate in order to reduce blood pressure. So one of the ways our blood pressure is controlled is through vasodilation and vasoconstriction of our arteries. And then they branch out even further into the tissues, and the smallest branches of the arteries are known as arterioles. The suffix "ol" just means a small thing. So an arteriole is a small artery. And then the arterioles branch into the capillaries. Capillaries are so thin that red blood cells can really only fit through them in a single file line. And so here is a diagram here of a capillary. So the capillaries are where nutrient exchange and gas exchange occurs in the tissues to the cells. So oxygen and nutrients leave the capillaries. They're fairly permeable. And the waste products of the cells, so carbon dioxide is the gaseous waste product, and any other metabolic wastes will get absorbed into the blood, and the blood is now deoxygenated and full of waste products, and that blood that will get carried back to the heart now through the veins, the venous system. So veins break down into smaller veins called venules. So really we go from the arteries to the arterioles to the capillaries, then to the venules and the veins, and back to the heart, and we keep circulating. Another difference between arteries and veins, besides the differences in the muscularness of the tissue, is that valves, since they're returning blood to the heart, they often have to pump against gravity, anything coming from your legs, your lower extremities. And since they're not very muscular and they don't have a way to really propel the blood, in fact, your veins really rely a lot on your skeletal muscles. So when you move, it helps to pump blood through your veins. But also veins, large veins anyway, have valves, similar to the heart valves. And valves, the purpose of valves in any system is to keep things going in one direction, keep flow of a liquid in one direction. And so it keeps the blood moving up without pooling back down the legs. So the pressure system in the arteries is much higher than the pressure system in the veins because the blood pumps, or the heart pumps blood into the arteries, and then by the time they get to the veins, that pressure has been greatly reduced. So you can't feel the pulse in a vein. You can feel your pulse in an artery, but blood pressure is much lower in the venous system. Alrighty. So a little bit more about those pressure differences. So in the arteries, because the pressure is so high, that the hydrostatic pressure is what we call it, is basically the physical blood pressure. And since it's so high, it actually pushes water out of the capillaries, the arterial end of the capillaries. So capillaries are much more permeable than your arteries. The purpose of them is to allow for exchange of nutrients and gases. And so the arterial end, because the hydrostatic pressure is so high, you'll see that water leaves and goes into the interstitial fluids here between the cells, and that's how cells can get water. Any excess water is then reabsorbed, though, by the veins, and that's because even though there's the hydrostatic pressure is much lower, the blood pressure in the veins is much lower, and what attracts the water back in is the high oncotic pressure. So oncotic pressure is kind of like osmotic pressure, and osmosis is the flow of water towards solute. And the solutes, the things that are dissolved in blood that attract water, are things like salts and blood proteins, namely albumin. I thought this was a cute little cartoon drawing of albumin protein kind of hugging a water droplet because he loves it so much. All right, so proteins, soluble proteins in your blood play a big role in helping to attract excess fluid out of your tissues so that it can be drained, carried to the kidneys essentially, and released as urine, as fluid waste. Any excess fluid that's not reabsorbed into the veins gets absorbed into the lymphatic vessels. So this green vasculature here is part of the lymphatic system, which is not part of the circulatory system, but it does very closely intertwine with the capillaries, and so it's the one time it's going to get a mention in this chapter for its role in absorbing excess liquid and helping to drain it out of the tissue. We're going to talk later about one of the circulatory disorders, which is edema, fluid buildup, fluid retention, and swelling in the tissues, and that oftentimes happens when there's a disruption of this process here. So either the lymphatic vessels are blocked and they're not absorbing the excess fluid, or the venous system is blocked and not able to absorb or carry out that excess fluid. So the circulatory diseases that we're going to cover in this chapter are atherosclerosis, which is a medical term, literally means the fatty hardening condition. So it's a condition where the arteries get fat plaque buildups, and they also harden. They get hard. The walls begin to harden. Thrombosis and embolism, which are issues involving blood clots. Hypertension, which literally is the medical term for high blood pressure. Aneurysm, which is a swelling of an artery that can then lead to rupture. Edema, which is fluid buildup in the tissues that causes swelling of body part. Shock, which is a dangerously low blood pressure. And these are all conditions of the arteries. And arteries being the parts that carry the oxygenated blood. Diseases of the arteries are much more serious than diseases of the veins. Diseases of the veins carry our deoxygenated blood, so sort of like the less important blood. It still needs to be able to complete the circuit of the circulatory system, but they tend to be less serious conditions. So varicose veins and phlebitis are the venous conditions we'll talk about. So atherosclerosis, a really important disease in developed countries especially. It used to be thought that it was caused by diet. There is certainly a dietary element to the disease, but we now know that it's actually induced by injury. So when the blood vessel is injured, whether it's through inflammation due to infection, due to high blood pressure, due to injury, all right, that the endothelium of the lumen of the blood vessel, it can become inflamed. And when it becomes inflamed, it gets physically roughened. So the lining, the inner lining of the blood vessels is very smooth. It allows the blood cells to just flow right by like a water slide. All right. And just like a water slide, if there's a rough patch as you go by, it hurts. And you might even get a little stuck right there. And that's kind of what happens with blood cells and fat in the blood. If there's a roughened patch on the blood vessel wall, then fat can start to deposit there. Stuff can start to get sort of stuck there. And so then it serves as that sort of like a nucleation point, and fat continues to deposit there, and sometimes blood cells will deposit there and form a blood clot called a thrombus. Thrombus is just the medical term for a blood clot. So technically a thrombus is a clot that is stationary, that's stuck to a blood vessel wall. And we'll also talk about emboli coming up. So an embolus is a thrombus that basically gets loose and travels through the blood vessels, and it can cause a blockage. A thrombus can cause a blockage too. So as we can see in this picture here on the left, and even in these pictures here, these cross sections of blood vessels, you can see how the fatty plaque buildup can start to occlude or block the lumen and really reduce the area for blood flow. This is a picture of an actual artery that has been removed because it was completely blocked and occluded by atheromatous plaques. So having arteries be blocked is problematic because then blood can't get through, which means that oxygen can't get through. So any tissues downstream of that are not going to get the oxygen they need. And if the tissues that the artery is feeding is the heart, that is what causes heart attacks. So if you have atherosclerosis in the coronary arteries, it can lead to heart attacks. If you have atherosclerosis in the cerebral arteries leading to the brain, that results in a stroke. And if you have atherosclerosis in the arteries that feed your kidneys, it can cause damage to the kidneys, which ultimately lead to kidney failure. So atherosclerosis is a chronic condition that can lead to all kinds of downstream cardiovascular disease. So there are a lot of risk factors for atherosclerosis. The 5 biggest risk factors are hyperlipidemia, which means high blood lipids, and the most important blood lipid in this is cholesterol. And in a moment, I'll talk about the different types of cholesterol. So high cholesterol. Hypertension, high blood pressure is another risk factor because hypertension, as we'll talk about, can over time really cause damage to blood vessels, which is is the initiator of those atheromatous buildups. Smoking. Smoking can also serve to damage blood vessels. Diabetes, which is, and really unregulated diabetes, so that involves high sugar concentration in the blood, which again messes with fluid balance and fluid regulation in the blood, which can increase blood pressure and damage the arteries. And then lastly, this one is really an indicator, I don't know so much a risk factor, but an indicator, an early indicator of atherosclerosis is people who have elevated CRP, C-reactive protein, which is that protein that's made by the liver when there's inflammation. And so again, inflammation is heavily involved in atherosclerosis. And then another sort of blood test chemical indicator is high or elevated levels of homocysteine, which is a form of an amino acid, and high levels correlate with an increased risk for atherosclerosis. So the one I want to focus on is hyperlipidemia. So hyperlipidemia just means high blood lipid levels, and mainly the ones we're concerned with are total cholesterol levels, but even more so the breakdown between these two types of cholesterol, the LDL cholesterol and the HDL cholesterol. So LDL stands for low density lipoprotein, and this is what we refer to as bad cholesterol. Really, neither of these are a type of cholesterol. These are lipoproteins. They are molecules, giant molecules that they transport cholesterol. And LDL is the bad kind because LDL tends to carry cholesterol and then spill it and deposit it in the blood vessels, versus HDL is more like an empty transport protein or vessel that can come by and actually clean up some of that deposited cholesterol. So the LDL is the good kind. You can think of HDL is the good kind. You can think of it as sort of like the cholesterol cleaner-uppers. And LDL is the bad kind because it deposits cholesterol. And so different treatments, different ways to reduce your cholesterol levels are exercise. Exercise has been shown to reduce LDL and increase HDL levels and reduce total cholesterol levels, primarily because you use fat when you exercise, you burn fat. Diet is another one, and it's not so much about avoiding cholesterol in the diet, that is important. It's not that cholesterol in the diet necessarily leads to high cholesterol in the blood, but there are certain types of fats that do tend to cause a rise in LDL levels, the bad cholesterol, and a decrease in HDL, the good cholesterol. So the fatty foods, or the foods to stay away from in your diet, are these bad fats, which are saturated fats, but even to a greater extent, anything that contains trans fats. So trans fats are a artificially made type of fat. It's taking unsaturated fat and then hydrogenating it, adding hydrogen, and it makes a type of dietary fat that's not actually found normally in foods. It's found in very small amounts in animal fat. And it turns out it's super, super bad for cardiovascular health. And in fact, it's banned in a lot of foods in a lot of countries. And in the US, it's been mostly taken out of almost all foods. So it is, the good thing is it's easier to avoid now, but for a while there, it was being marketed as a heart-healthy fat, as an alternative to saturated fats. But then we learned it's actually worse than saturated fats. So not all fats are bad. Just because hyperlipidemia deals with fats doesn't mean all fats are bad. And actually, there's a lot of fats that are very good that actually help to increase our HDL, or high density lipoproteins. And those are the unsaturated fats, particularly omega-3 fatty acids. And those fats those omega-3 fatty acids also have anti-inflammatory properties, which also helps to reduce inflammation in the blood vessels that leads to atherosclerosis. If those things are not able to control blood lipids, there's also medications that can be taken, and the most common one, very common medication for hyperlipidemia is statins. They are pharmaceuticals that lower your cholesterol. So the treatment for atherosclerosis, or two common treatments for atherosclerosis. One is a percutaneous coronary intervention. In other words, using a catheter to go up into the coronary arteries and insert a stent using a balloon, doing an angioplasty. So this the word angioplasty means a procedure to reshape the vessel, the blood vessel. And so it's less invasive. It doesn't require surgery. It does involve some level of anesthesia, and then a very small tube that's fed in through the femoral artery in your upper leg and all the way up the abdominal aorta, through the aorta into the coronary arteries. So this is done with a CT or X-ray, some kind of imaging to follow the trajectory of this catheter. But at the end of the catheter, there is a balloon, a deflated balloon with a stent on it, and then the balloon, when it's in place, in the place where there's a blockage, it's distended, and the stent is like just like a cage that kind of opens up and pushes back against that fatty plaque to open up the artery and allow blood to flow through it. Stents are not really a permanent solution. Usually they have sort of a shelf life or a lifespan because the fat can be deposited on the stent and the plaque can continue to grow. There are some that are impregnated with medication that helps to slow that process, but usually they have to be replaced after 5 to 10 years. But it buys you a little bit more time. And even more than that, if coupled with lifestyle and exercise, diet and exercise changes. A more invasive procedure is a coronary artery bypass graft. So this is an open heart surgery. It's often referred to or abbreviated, since its abbreviation is CABG, it's often just called a CABG procedure. And this is a full bypass procedure where the heart has to be stopped and blood has to be run through a heart and lung machine so that the heart can be operated on. And what they do is they take a blood vessel from somewhere else in the body, usually the leg, and they graft it in to bypass the occluded coronary artery. So if here's an artery right here that has a giant plaque in it and blood is not able to flow through it, they just take this other artery and they sew it to the end here, and then they sew it to somewhere on the aorta so that blood can still get to that area of the heart through this alternate route, this bypass pathway. So atherosclerosis, we said on this slide here that part of it is that these lesions can form and you can get these blood clots, these thromboses. There are other reasons that thromboses can form, and what they are is just a big blood clot. Now the clot itself can cause a narrowing of the lumen and reduce blood flow through an artery, but also that thrombus can get loose and part of the clot can break off and travel, basically get swept up in the current of the blood and travel. And that embolus, that traveling blood clot, when it goes into the smaller arterioles, when it makes its way to the smaller arterioles or capillaries, it can cause a blockage. and that blockage completely blocks blood flow, which causes ischemia. Ischemia is the medical term for blocked blood flow. And if that blocked blood flow, if that flow of blood is blocked for an extended period of time, it can lead to death of the tissue, necrosis, due to complete lack of oxygen. So there are other causes of blockages. There are other materials that can cause blockages in our blood vessels. So fat, a plaque itself a piece of a plaque, a fatty plaque could break off. But a more common cause of fat embolism is when a bone fractures. The bone marrow is very fatty. And so if you get a bone fracture that, especially in a large bone, that releases a lot of bone marrow into the blood circulation, which it is not, fat is not water soluble, doesn't dissolve in the blood. So they form these globules, and that can cause ischemia. You can have septic emboli from bacterial or fungal infections, literally like a clump of bacteria or fungi. Oops. Back to my slide. You can have a gas embolism if someone injects gas, an air bubble. That's why when you load a hypodermic needle, you always have to squirt the air out, because it's not good to have gas bubbles in your blood vessels. Tumor cells, metastatic tumor cells, can form an embolus and block blood flow. And then another type, specific type of embolus that can happen in pregnancy is called an amniotic fluid embolism, which happens if there's a tear in the uterus and in the amniotic sac, such that amniotic fluid from the uterus gets into the vasculature, and it can also cause an embolism, a blockage that leads to ischemia and potentially necrosis. So embolism is a very serious, life-threatening condition depending on which blood vessel the flow of blood is blocked. So a particularly serious type of embolism is a pulmonary embolism. This is when the thrombus or fat or whatever gets lodged in one of the pulmonary arteries. The larger the artery that's blocked, the larger the area of ischemia and necrosis in the lung. If it is a particularly large one and it blocks like the main pulmonary artery, death is pretty much instantaneous. And so this is a very serious condition. If it's a smaller area, there might be chest pain and shortness of breath that someone experiences. But if it's a large one, then they often just lose consciousness and are not breathing and die very quickly. A common cause of pulmonary embolism, and one that doctors are always on the lookout for, especially after surgery, is something called a deep vein thrombosis, or DVT for short. I'll write that, DVT. So a DVT is a thrombus, a blood clot that forms in one of the large veins in the legs. So remember, blood flows up through the veins in the legs largely through muscular contraction of your skeletal muscles, and also through the functioning of these valves. So if either the valves aren't functioning properly, or you are immobilized because maybe you had surgery and you're bedridden, or you've been on a long car trip or flight and you've been sitting for a long time and not moving your legs, the blood can kind of pool there and form a clot. And then if that clot lets loose, it can travel through the vasculature and end up stuck in the pulmonary arteries. So how is it diagnosed? It's diagnosed through symptoms in the leg. Sometimes you get swelling and pain associated with DVT, but a big thing with DVT is prevention. So we know that simply through like massage and using the leg, doing some exercises, if you're ever on like a long flight, they'll oftentimes make you watch a video about DVT and some little leg exercises you can do in your seat just to make sure that you keep your circulation going. You can also wear compression socks, things that help to compress the blood vessels to help keep the blood flow. And I know after I had a C-section, when I had anesthesia, so I was numb from the waist down, and as my sensation started to come back, I felt this pulsating, some kind of like massage on my lower leg. They had put like basically like a massaging wrap, like a wrap, kind of like a blood pressure cuff that squeezes and then relaxes, but it did it automatically. So it was on my legs to keep my blood flowing to prevent DVT. So we can diagnose these blockages through a type of radiographic test called an angiogram. So this is where a dye, a radio contrast dye, is injected into the arteries, and then you undergo CT in order to be able to see the arteries and to see whether the radio contrast dye is flowing through them or not. So this is, I liked this image. It shows, this is some coronary arteries, and in this picture the blood flow kind of stops here. You can see it there's like a very faint vessel kind of here, but nothing down here. There's a lack of blood flow down this part of the heart here, this anterior part of the heart. And then after a procedure was done, probably an angioplasty to help fix that blockage, afterwards, the after angiography, we saw this nice beautiful line here. The dye goes all the way down and the blood is flowing now. So the treatments that can be done, just like we saw before with the atherosclerosis, we can do an angioplasty procedure. Also, we can treat it with medication, with anticoagulant drugs. If the clot is particularly bad, we can do something called thrombolytic drugs, which break up blood clots. But typically we put people on anticoagulant medications to prevent further blood clots from forming, to keep the clotting down, sort of reduce blood clotting in general, to prevent any more blood clots from forming. Another disease of the cardiovascular system is hypertension, chronic high blood pressure. So when your blood pressure is normal, it's flowing at a nice rate that's comfortable for your blood vessels, not too stressful for them to handle. Think of a river that's just like flowing smoothly, okay? Hypertension, think of a river after a storm where the water is pushing against the banks, it's knocking out bridges, right? So water, things with flow can actually do a lot of damage. They apply a lot of pressure. So same thing with the blood. When your blood pressure is high, it puts a lot of pressure on the walls of your arteries. And then the arteries, in response, so that they don't rupture based on that high pressure, they get thicker. They get thicker and they kind of stiffen, which is actually not good for them in the long run. And so another thing that happens is your heart has to work harder. As your blood vessels get stiffer, they are less elastic. And so your heart has to pump harder because now the blood pressure, the lumen is narrower, so it has to push harder to get the blood to go farther. And so what happens then is the wall of your heart, particularly the left ventricle, starts to thicken as well. And we typically think of, oh, muscles work harder, they get stronger. Not so much with the heart. The heart's more like, think of like a car engine. If it has to work harder, it gets tired faster. And so hypertension can lead to hypertrophy, overdevelopment of the heart, which then leads to heart failure, basically exhaustion. So what is a healthy blood pressure? Healthy blood pressure, normal blood pressure, is somewhere around a systolic blood pressure of 120 and a diastolic blood pressure of 80. Remember, systolic is the pressure when the heart contracts, and diastolic is the pressure when it relaxes. Systolic is usually higher, should always be higher. It can be elevated a little bit more than that. Sometimes for some people, that might be their normal. For some people, it's a sign that their blood pressure is starting to get higher and they are at risk of developing hypertension. So there are different stages of hypertension based on how high over that normal value you are. And an extremely high blood pressure this would be a crisis reading if it's higher than 180 and or higher than 120. On the diastolic reading, that is an emergency situation where you need to contact a doctor right away. So the problem with high blood pressure is it can damage all these other tissues, right? So it can damage your blood vessels, which can lead to things like aneurysms, which we'll talk about. It can damage the heart, which can lead to heart failure, and it can also damage the kidneys. I guess I'm getting ahead of myself here. This is the slide. Okay, so hypertension complications causes a thickening of the blood vessels, which can cause aneurysm, which is the next slide. And it can also lead to damage of key organs like the brain, the heart, and the kidneys, leading to kidney failure, heart attack, or stroke. So there are ways, lifestyle changes, diet, exercise, that can help to reduce blood pressure. Drinking more water, eating less salt, getting more exercise, eating more fruits and vegetables and less meat. All of those things can help to reduce hypertension. But there are also medications that can help. So diuretics are a class of medications that increase salt and water loss by the body. So basically they make you pee out excess fluid, and that helps to reduce blood volume, which can reduce your blood pressure. You have to be careful not to over dehydrate yourself on diuretics. So fluid balance is key, and overdoing diuretics can mess with that. Beta blockers and calcium channel blockers and ACE inhibitors all help to reduce vasoconstriction. So when blood vessels constrict, your blood pressure goes up. And so if you reduce that, you relax the blood vessels a little bit more, it reduces blood pressure. We don't want to overdo that though, because then your blood pressure would drop and be very, very low. That's hypotension, and we'll talk about that coming up. So one of the damages of hypertension, chronic hypertension, is it can cause a weakening of the wall of the blood vessels. So I said that it can cause them to harden and thicken and lose their elasticity. Or the alternative is that it can cause them to become sort of stretched out and lose that elasticity and not be able to stretch back in, right? So they kind of stretch out and then they're very thin and weak walled. And so an aneurysm is often, you can see it on a CT scan as sort of a swelling, a bulging, if you will, of a blood vessel. And so you can have it bulge on one side or it can bulge on both sides. But either of these bulges, these aneurysms, are very fragile and can easily be ruptured. And it's rupturing of the aneurysm that's dangerous. So the aneurysm itself doesn't typically have any symptoms. There might be some pain or some weakness or something, depending on where that aneurysm is, but generally you don't have symptoms until it ruptures. And depending on where it is, that rupture can be fatal. So This is the saccular aneurysm is the most common form that in cerebral aneurysms that form in the vasculature of the brain. And when those rupture or hemorrhage, it causes extreme headache, head pain, could cause unconsciousness, and in the more extreme or acute scenarios, it causes such a severe lack of blood flow to the brain that you don't resume consciousness. Another really dangerous type of aneurysm is an abdominal aortic aneurysm, which is often just referred to as a AAA. And this is an aneurysm in the very, very large blood vessel here in your abdominal aorta. And it's pretty much always asymptomatic until it ruptures. And when it ruptures, you bleed, you lose so much blood since it's such a major vessel, and the blood pressure is so high when the blood pumps that you lose consciousness nearly right away and bleed out very, very quickly. It's almost always fatal in a very, very quick way. So aneurysms are often diagnosed either after they rupture or as incidental findings on a scan. So I have a story of a friend who he was in a car accident, and he was like about 50 years old, let's say, and he was in a car accident and he felt fine, but it was a serious enough accident that the doctors wanted to do a full body CT scan to ensure he didn't have any internal hemorrhaging. And when they did that, they found that he had an abdominal aortic aneurysm. It was not ruptured, luckily, and they were able to do surgery to repair it or to ensure that it would not rupture. And so in a way, that car accident kind of saved his life, because it's essentially a ticking time bomb that can rupture at any moment. So similar thing with cerebral aneurysms in the brain, especially if they're large enough, they can, when they rupture, they cause such severe hemorrhaging that there's no coming back. Another condition that's associated with circulatory dysregulation is edema. So edema is the medical term for swelling due to fluid retention in the tissues. So remember that fluid leaves the arteries and enters the tissue, and then it's supposed to go back in to the venule side of the capillaries in order to get rid of the fluid. So there's this fluid balance, if you will. We give water, we take, water goes out, water comes back in. When there's dysregulation, there's more fluid going into the interstitial tissue, and there's a lack of absorption and getting rid of that fluid, whether it's due to the venous system not doing its job or the lymphatic system not doing its job. And so here's a normal foot versus one that has edema. We sometimes call it pitting edema. If it's inflammatory, if it's due to inflammation, there's oftentimes it's oftentimes not pitting edema. So if you have a sprained ankle, for example, it'll be red and hot and swollen. That's edema, but it won't be pitting edema. Literally what pitting edema is, if you poke it with your finger and then you remove your finger, there's still a little indentation where your finger was, and it slowly fills back up. So inflammatory edema is not usually pitting edema, but some of these other types are. So it's very common in pregnancy, for example, for the ankles and feet to swell and to have this pitting edema. When I was pregnant, during my second pregnancy, actually both my pregnancies, I had my older children get to play the game of poking my feet and making little indentations. And I have videos of it. They thought it was the funniest thing that their little fingerprint didn't go away. They could make these little divots in my feet. So it's, a true phenomenon. So it can be due to a lack of proteins, plasma proteins in the blood. So if your liver isn't making enough albumin because of liver disease, or if your kidneys are for some reason excreting albumin in your urine, you shouldn't be doing that. Normal urine doesn't contain protein, but if there's damage to the vasculature in the kidneys, then they start to get rid of too many things. If you are malnourished, not getting enough protein, then that can also reduce the amount of protein in your plasma and cause fluid retention. If you have heart failure, someone with heart failure has increased hydrostatic pressure, so it pushes more fluid into the, I guess this situation here is pushing more fluid into the tissues than it's pulling out. And then also if you have some disease that causes lymphatic obstruction, if there's a tumor in the lymphatic system, or there are some parasites that actually cause blockages of the lymphatic system, and so then that extra fluid can't be drained through the lymphatics, it can also lead to edema. So there's lots of different underlying causes of edema, but essentially anytime you have edema or swelling, it's because of this imbalance of fluid regulation. Another very life-threatening complication of blood vessel diseases is shock. So shock is a physiologic response that results in very low and sustained low blood pressure, or hypotension. It's the opposite of hypertension. So this low blood pressure, this drop in blood pressure is dangerous because if your blood pressure is too low, then you're not effectively pumping blood and oxygen and nutrients to your different organs. And then if they're not getting oxygenated, then they will start to fail. And so shock can lead to multi-system organ failure. And so there's different causes, different things that can trigger this drop in low blood pressure. One, the sort of most obvious one, most textbook one, is hypovolemic shock. Hypovolemic literally means a low volume of blood. Okay, so this can happen after severe blood loss. If you lose a lot of blood, you can go into hypovolemic shock. And so the treatment for that is to replace the blood transfusion and IV fluids in order to have enough blood to circulate. Another cause of hypovolemic shock can be if you have severe diarrhea. So people with cholera causes such severe diarrhea and water loss that your blood volume shrinks because you're basically excreting like all the water from your body, including your blood. So it very quickly. So it just results in reduction in blood volume, and that's oftentimes what people die from. In people who have cholera, they die from hypovolemic shock. So actually the major treatment or therapy for cholera is not actually which is a bacterial illness, it's not an antibiotic, it's not to treat the bacteria, it's to give fluids and electrolytes to replace the fluids and electrolytes that are lost in the diarrhea, and that is generally enough to keep them alive, to keep them from suffering from hypovolemic shock until their body overcomes the bacterial infection. Another type of shock is cardiogenic shock, and that happens when there's heart failure or a heart attack, a myocardial infarction, so the heart's not able to pump properly, and you have like fibrillation. Cardiac tamponade, which is when there's fluid buildup around the heart, and so it can't pump as well because it can't fully open in order to contract. And then distributive shock. So the two types of distributive shock. Distributive shock is when you have massive vasodilation. So if these are your capillaries and your arteries and your veins normally, they all become dilated, like all over your body at once. Systemic vasodilation. And when the blood vessels dilate, the blood pressure drops. And so this can happen due to sepsis, which is an infection of the blood by bacteria or fungi that lead to a whole bunch of cytokines being released that cause massive vasodilation. Remember, at the tissue level, when there's tissue injury, vasodilation locally is a good thing because it brings white blood cells to the tissue to help, fight infection and to heal the damaged tissue. But on a systemic scale, that vasodilation is not a good thing. Another thing that can cause systemic vasodilation is anaphylaxis, which is also an immune response. So both of these causes of vasodilation are really the immune system. So the treatments for shock will vary a little depending on which type of shock it is, because if it's hypovolemic, we just want to replace fluids, particularly blood. We really want to replace blood. So trade out this IV bag with a blood transfusion. Versus if it is distributive, so if it's due to vasodilation, we probably don't need to add more blood volume. What we need to do is make the blood vessels constrict again. And so we can give medications that are vasoconstrictors. And that's essentially how EpiPens work. They help to constrict, vasoconstrict, to combat that distributive shock. With bacterial infections, with septic shock, it's very difficult because people with septic shock will get these treatments. They'll get vasoconstrictors and they'll get IV fluids, but the vasodilation oftentimes will just continue as that bacterial infection thrives. So they also need to get antibiotics to treat the underlying bacterial infection to ultimately stop the immune response that's causing this shock reaction. And then, so that was all the diseases of the arteries, of the arterial system. Now for some diseases of the veins. Really, it's just one slide. And so varicose veins and hemorrhoids are actually the same thing. They are swollen veins. Varicose veins are swollen veins in the legs, and they are fairly common because the legs have fairly large veins with these valves that are important for keeping the flow of blood unidirectional up the leg. And if those valves become impaired, it can result in pooling of the blood in those veins, and then it causes them to become distended and distorted and swollen. And so you get these very visible swollen veins that are very superficial and easily seen through the skin. Ooh, something I didn't mention before but should mention is that veins, you tend to be able to see your veins through the skin because veins tend to be much more superficial, closer to the skin, because they are less important in the sense that they carry deoxygenated blood. So if you're going to cut yourself and you're going to bleed, you would want to lose deoxygenated blood, right? So arteries tend to be buried deeper in the tissue, and which is why there are only a couple of places on the body where you can feel your pulse. Those are the couple of places where the arteries are superficial enough to actually feel them. And so, yes. Okay. Varicose veins are in the legs. Hemorrhoids are veins in the rectum and anus that become swollen. And that can be from straining during defecation when you're sitting on the toilet trying to poop. It's also a very common sort of after effect or side effect of labor and delivery after pregnancy and undergoing labor and delivery and all that pushing. It can lead to swelling of these veins in the anus or rectum, which can cause pain and discomfort and can also sometimes rupture and lead to bleeding. None of these are really like life-threatening diseases or conditions, though this one can be, because again, the DVT, I guess, the deep vein thrombosis, is a vein disease where the blood pools and forms a clot, and then that clot can rupture, or the clot can break free and cause an embolus, and that's dangerous. The clot might also block the vein and cause it to become inflamed. So that would be thrombophlebitis. Itis, remember, means inflammation. You can also get infection of a vein, particularly after if there's like if you have a cut or some kind of trauma, or at an injection site, if you have blood drawn and your vein is kind of angry or a little infected afterwards, that would be phlebitis. So that is the end of chapter 12. Thanks for watching.